Hi to all of you. In the chapter Why Do We Fall Ill? We will be discussing mainly about the infectious diseases one by one. Malaria. Malaria is a disease which is very common in our country. Its causative organism is Plasmodium, which is a protozoan. The vector which carries it from an infected person to a healthy person is female Anopheles mosquito. When female Anopheles mosquito sucks the blood from an infected person, the Plasmodium enters the mouth of the Anopheles mosquito. Now, when this Anopheles mosquito bites a healthy person, then through its saliva, the Plasmodium is transferred to the healthy person. This is how malaria spreads from an infected person to healthy person. Here, female Anopheles mosquito is the vector of the disease. The specific symptoms of this disease is high fever with pattern of hot and cold. It means that first of all the fever rises and then it comes down with sweating. Severe body ache occurs. The preventive method is to use insect repellents or mosquito nets or add kerosene oil to the open drains or ponds where there is stagnant water, because when there is a layer of kerosene on the water, the larva of the mosquito cannot come on the surface to respire. Thus, it dies. If a person suffers from malaria, in that case, prescribed dose of quinine is given. The next disease is jaundice, which is caused by hepatitis virus. It affects the liver. The mode of infection is through contaminated food and water. The main symptoms of this disease is high fever, headache, nausea, vomiting, loss of appetite. The person does not feel like eating anything. And the specific symptom of the disease is dark yellow urine, yellowishness of eyes, yellowishness of skin. The prevention of the disease jaundice is to maintain good hygiene and sanitary conditions, not to eat contaminated food. Rabies. We have heard a lot about rabies. It is caused by rabies virus. A person gets infected from rabies if he or she is bitten by an infected animal. The main symptoms of the disease are severe headache, fever, painful contraction of throat. The specific symptoms are hydrophobia. The preventive methods are, if there is an animal bite, then in that case, clean the wound with medicated soap. After that, there should be a course of anti-rabies vaccine. But if a person suffers from rabies, in that case, there is no treatment. AIDS, acquired immunodeficiency syndrome. It is caused by retrovirus. It spreads through sexual contact, infected needles, blood transfusion. The symptoms are swollen lymph glands because it affects the immune system. Blood platelet count decreases. It decreases the immunity of the person. Fever, night sweating, weight loss are some other symptoms. For prevention, avoid sexual contact with unknown person. Avoid use of reusable blades, razors, etc. If a person suffers from AIDS, then there is no effective treatment for the disease. The next viral disease is polio. It is caused by polio virus. Spreads through contaminated food and water. The symptoms are sore throat, headache, fever, vomiting, muscular pain, stiffness in neck. The specific symptoms are tingling sensation in limbs and deformity of limbs. Prevention and control are, if a person suffers from polio, then he should take complete bed rest. Physiotherapy can help that person. Good hygiene should be maintained. Oral polio vaccine should be given to kids so that the disease can be prevented, and follow pulse polio program. Tuberculosis is a bacterial disease. which is caused by Mycobacterium tuberculosis. Tuberculosis is caused by inhaling those droplets which are released in the air by coughing or sneezing of an infected person. In case of lung tuberculosis, the symptoms are persistent cough, chest pain, blood-stained sputum, and prolonged low-grade fever. This fever rises in the afternoon. To prevent tuberculosis, good hygiene and sanitary conditions should be maintained. BCG vaccination is another preventive method. If a person suffers from the disease tuberculosis, then in that case, anti-tubercular therapy should be given. It is a treatment which is quite long. The treatment should be continuous and there should be no break in this treatment. Otherwise, the anti-tubercular therapy has to be started from the beginning. Typhoid. It is caused by a bacteria known as Salmonella typhi. It also spreads by not maintaining proper hygienic conditions, like it can spread through contaminated hands, water, and by eating the food which is contaminated with fecal matter of the infected person. The symptoms are typical fever that rises in the afternoon and keeps increasing each day for 7 to 8 days. In the second week, there is high fever, and in third and fourth week, there is a decline in fever. For prevention and control, proper hygienic and sanitary conditions should be maintained. TAB vaccination should be given. And if a person suffers from typhoid, then there are standard drugs for its control. Diarrhea can be caused by bacteria or viruses or protozoa. It spreads by consuming contaminated food and water. The symptoms are frequent loose motions, vomiting, which can lead to dehydration. Sometimes there can be fever, and if it persists for a long time, then there can be weight loss. It can be prevented by maintaining personal hygienic conditions. Oral rehydration solution should be given for rehydration. If a person suffers from diarrhea, then in that case, antibiotics or antidiarrheal drugs can be given for control. I hope you all must have understood it well. Thank you.